How to exercise without pain. Pain-proof your workouts. 11 simple strategies that work. You know how the old saying goes, no pain, no gain. I can hear it now coming from the mouth of my high school football coach. Acute pain. Have you ever been lifting when you felt something pop, sting, tingle, or even crack? Most of us have all been there and later desperately wished it could have been avoided. These types of sensations felt while exercising are the keys to identifying acute pain. Acute pain is pain that occurs rapidly over a short period of time and in most cases instantly. This is the kind of pain that most athletes and lifters fear. Sudden pain felt while participating in some sort of exercise often leads to serious injury if ignored. The best response to acute pain is to stop what you are doing and figure out what just happened. If the pain is continuous, seek medical advice immediately. If the pain is alleviated by rest, then monitor the injury and make a mature decision based on your symptoms. Acute pain is the negative aspect of pain that we all should try to avoid. Most injuries that occur instantaneously are due to a lack of stretching, skipping a warm-up, dehydration, stupidity, and even pride. Avoiding acute pain. Stretch, stretch, stretch. I have seen too many athletes limp off fields, roll off benches, and drop weights because their muscles were not actively prepared for their actions. Exercise, whether it is running, swimming, jumping, or lifting, all require the use of muscular contraction and flexion. Stretching allows the athlete to place minor stresses on the muscles, small and large, in order to prepare them for the preceding events. In stretching before and after workouts, the athlete is setting his/herself up for injury. Stretching before workouts allows the muscles to be loosened, thereby increasing range of motion. Warm-up. Oftentimes a warm-up will include stretching but also cardiovascular activities. Warm-ups should take about 5 to 10 minutes depending on the event. By jogging, riding a bicycle, or even using an elliptical, the body is allowed to get blood and nutrients flowing to muscles throughout the body. It is important because the body needs preparation. The heart can gradually beat rapidly, muscles can work a bit harder, and blood can flow faster. Drink lots of water. Water is the body's most abundant chemical, making up nearly 80% of the human body, depending on size. By hydrating the body, every aspect of the anatomy becomes further nourished and lubricated. Muscle cells that are well hydrated can more adequately adjust to the change in motion that occurs during exercise. Attitude and technique. I mentioned stupidity and pride as contributing factors in acute pain. I mention these two things because they are often overlooked when discussing the science behind pain. These characteristics often go together because typically it is pride that leads to stupidity. Never let pride get in the way of technique. If proper form is maintained while exercising, you will save yourself from much regret. When you are preparing for an event, leave your pride at the door, humble yourself, and think before you act. Delayed pain or soreness. Now it is time to discuss the good pain that we have all endured. Soreness is most often the result of working new muscle fibers and/or using the same muscles in different ways. Delayed onset muscle soreness, or DOMS, is the medical term used when dealing with the pain felt 12 to 48 hours after exercising. The difference between acute pain and DOMS is that DOMS is usually harmless and usually a sign of growth, while acute pain is a serious threat to one's health. A physical therapist once told me this after injuring my back: if you hurt at all in that area while performing an exercise, then you are doing something wrong. However, if you hurt at all the next day from exercising, then you have done something right. I have taken this statement to heart and used it to seek delayed soreness while avoiding acute pain. When the body becomes used to performing a certain motion, soreness usually begins to fade away. For most athletes, this is the time when a routine change is needed. Soreness is typically used then as a guide in determining when muscles are ready to be shocked with new exercises. Avoiding DOMS. Despite the desire to feel the soreness factor after a well-structured workout, there are ways to limit the magnitude of soreness, thereby increasing recovery time. The primary trick to lessening the degree of pain felt post-workout is stretching. Stretch all muscles wisely, while focusing intensely on the primary muscles that were involved in the exercise. The effectiveness of stretching has already been discussed above. Many hard-nosed athletes and coaches preach the importance of painful workouts yet fail to watch for signs of possible injury. Yes, muscle fatigue and soreness is a good sign when attempting to improve one's fitness. However, all pain should be monitored closely to avoid setbacks. Acute pain can be avoided by maintaining a good stretching program, warming up prior to exercise, drinking plenty of fluids, and keeping your pride in check. Delayed pain should be used as a guide during an exercise regimen, and confusing your muscles occasionally can induce serious gains. Use supplements only to supplement your body, and do not load up on supplements just to cheat yourself in the gym.